All right, Dr. Bloom, it's great that you're here at Hopeworks.
Thank you.
And so just a couple quick thoughts. What's it like to come here and see Sanctuary, that which you created, in flesh here at Hopeworks?
It feels like it is being implemented, and that's really exciting. It feels good to see that, to feel that there's an environment that is not violent, where people are really learning, and learning to relate to each other. And that's really what Sanctuary is about. So it feels great for me.
What were some of the maybe one or two things that most struck you that remind you about Sanctuary at Hopeworks?
I think it's the having a healthy structure. What I felt everywhere with everyone I spoke to was that there's a real clear pathway for people to learn and grow and change. And I think that's Sanctuary is the context within which that occurs, but it doesn't occur by magic. It takes a lot of really hard work and a lot of structure to make that happen. And that's what I see that interplay here as being really healthy, opening up a lot of possibilities for the young people that are here.
How about just your reflections on Camden and places like Camden and why it seems that they're not noticed?
Well, I think what happens in Camden and across the river in Philadelphia is that they are in many ways cities that are part of our history as a country, and now they are in complete disrepair. And it, to me, says so much about what's the problem in the country as a whole. And I think it's so painful that we can't bear to look at it, and we can't bear to really get our heads around the lives that so many people are living in poverty, because our whole system is based on everybody can make progress, pull yourself up by your bootstraps, everybody has a chance at it, and that is simply not true. It's not, maybe it was at some point in time in our history true, but it is not true today. That the odds are so stacked against young people who are born into poverty, wherever that is, whether it's in Camden or in Philadelphia or, out in some rural part of any of the states, that people who are born into poverty do not have an equal chance. And there is not social justice in this country yet. And we pride ourselves on thinking that we are socially just. And so I think the ignoring of the plight of young people in our cities is because we can't bear it, and we don't know what to do about it. We don't know how, within the context of our economic and social framework, to really create a system that is more socially just. And it would just be good if we just could start talking about that.
But it's true that with many advances today in brain health, we're understanding what happens to people when they live in these situations with chronic stress, toxic stress. Would you speak a little bit about what happens to someone's brain?
We're learning a lot about what happens to children's brains who are exposed to the unrelenting stress that goes along with growing up in poverty, and the toxic stress of not having enough food to eat, not having enough clothes, not having proper educational facilities, not having parents around, neglect, abuse, any kind of trauma in childhood affects the way the brain develops, because most of our brain development happens after we're born. So the effect of toxic stress on children's brains, literally on the way it's called the brain architecture, the way the brain gets wired and put together, is pretty profound. It varies. There's enormous individual variation, and not everyone is affected in the same way. But we know enough to know now that we are really allowing millions of children in the United States to have brain damage before they're even in school. And that's a crazy way to run a culture.
So when I say to you that 50% of the population of Camden is 25 or below, what does that mean in relation to the ship, what you just said?
That means that an extraordinary proportion of the population of Camden, of the young people, have not had what they needed in order for them to maximize their what they came into the world with, and that's not fair. That is not a system of justice that we should be content to live with. It's really a public health emergency.
And an epidemic.
And an epidemic.
So the last thing then is as we think about an epidemic of brain damage, literally, that people's brains, young people's brains, are being attacked, are not being supported, and literally are being harmed. How can we think of health and healing in light of this?
Well, we really have to take this on as a public health challenge. When I was young, a psychiatrist named Herb Needleman was in my department, and he was the one one of the people that made this clear connection between the lead poisoning that was in the paint in children's homes and what it was doing to children's brains. And that there was a huge public health response to that, to eliminate all sources of lead that kids would have exposure to in the environment. Well, poverty and abuse and neglect, that's this generation's lead poisoning. And we need to be doing something about it from a public health perspective. That means that we have approaches that address the people that are most affected. We have approaches that address anybody at risk. And then we have approaches that inform the entire public. And that's really what a public health approach means, everybody, and has to include everybody. So when we're talking about healing and recovery, then we're really talking about thinking very broadly about creating a knowledge base that everybody shares and a language that everyone shares, and the skills for rebuilding communities. And that's what we all need. We need safe places to have children grow up and be healthy. And in cities, in Camden, in Philadelphia, in cities wherever there is poverty, there is going to be an increased level of violence, and those are not safe places to raise children. So we have to see that as a public health emergency.
So though a public health emergency, it's not hopeless.
No, it's not hopeless. It really is. That's what Hopeworks is about, right? It's no, it's not at all hopeless. It's not even rocket science to create safe environments, safe families, safe communities. We all want that. Every human being has some notion of what it feels like to be safe. And we just need to be talking about that. We need to be extending that out. Sanctuary it's pretty basic. It's not, you do not have to be a nuclear physicist to know something about how you create a safe relationship. Everybody has it within them to do that. It's just a matter of practicing.
So one of the ideas here in Camden is to bring together organizations, 10 of them, into what we're calling the Healing 10, to create a citywide movement of healing around sanctuary to at first reach a third to half of all youth. Can you speak a little bit about what you think that would mean and what it could do?
I think that's really exciting, because I think what we've done in the sanctuary model is that we've organized long-standing human wisdom into a whole package and a set of skills, and that anybody can use. In a community, you have to reach a tipping point. You have to have enough people who are using the values, talking the language, have the knowledge to be able to get that tipping point and change a whole community of people. So it's really about how do we take a community that's become violent and create nonviolence. And it isn't impossible. You do need people who are committed to doing that and who are willing to do the hard work of wrestling with a set of values and beliefs and informing other people in order to make that happen. And so it's entirely possible to do it if we just decide that's what we're going to do. We've done amazing things when human beings can work collectively, and collectively we can solve problems.
Well, I just want to thank you for becoming a part of Hopeworks and becoming a part more deeply about Camden and Camden's future.
It's a pleasure. Thank you for asking me.
Thank you.